Good afternoon to all. My name is Bennett Choi, and it's a privilege to be able to present my team's work on the acculturation strategies and their impact on mental health of migrant populations. There are a lot of reasons why people migrate, be it for political, economic, or environmental reasons. One recognized consequence of migration is the impact it has on the mental health of migrants. This is why our team has decided to study the degree of acculturation of migrants in their host nation and how that affects their mental health. The main model we use to classify the degrees of acculturation of a migrant to the new host society is the Berry's model of acculturation. There are four main acculturation strategies. Integration refers to the strategy when someone from a different culture adopts the cultural norms of a country they've moved to while retaining their own culture. Assimilation refers to the strategy where someone adopts new culture while rejecting their own cultural norms. Separation refers to the strategy where someone retains their own cultural norms but reject the new culture of the country that they have moved to. And marginalization refers to the strategy where they reject both the new culture and their own culture. Before we start, I would like to define the word migrant in our study. We use the term migrants to encompass refugees, asylum seekers, displaced people, and migrants that move from one country to another. This study has got two main aims. The first is to find the correlation between the different types of acculturation strategies and their effects on mental health of migrants, such as depression, anxiety, and post-traumatic stress disorder. The second aim is to explore factors that may impact the acculturation and the mental health of migrant populations. We did this through a scoping review where we first identified relevant articles from databases such as PubMed, Ovid, and EBSCO by looking for relevant synonyms for the words migrants, mental health, and integration. The articles were then screened and filtered with the inclusion and exclusion criteria. And these are our results. A total of 21 primary studies were included in the review, which assessed more than 61,000 migrants in total. The migrants in these studies originated from multiple countries such as Russia, the Middle East, former USSR nations, and North African nations. And the host destinations were mainly European countries and North America. Our study showed that marginalization, which is the rejection of both the host and their own culture, was associated with the worst depressive symptoms. Conversely, integration was associated with the least depressive symptoms. In addition, we found a negative correlation between the acculturation levels and the symptoms of depression, anxiety, and post-traumatic stress disorder in general. Moreover, our study has also identified factors that may affect how well migrants integrate into their host country and their risk of developing mental health conditions. These factors include significant mental health conditions, extremes of age, host language proficiency, and low education status. Our results have highlighted the importance of integration and its positive impact it has on migrants' mental health. Host nations should aim to implement policies and schemes to encourage migrants to not only adopt the new cultural norms, but also retain their own culture as well. This would serve as a primary prevention against the development of mental health conditions within the migrant population. Our systematic review has also highlighted factors that negatively correlate to lower acculturation levels and worse migrant mental health. In light of resource scarcity, funding should be effectively channeled to address these factors highlighted. The building of social networks is likely to be very important. Local communities can help establish support groups and shared interest groups to help provide avenues to create meaningful relationships with both the locals and the migrants. Negative factors such as low skills, low education levels, and unemployment needs to be addressed too. Host nations should provide migrants with opportunities to pursue further education and skills training that's relevant to local economies. This would not only help integrate migrants into the host society better, but also give them the means to be self-sufficient and financially independent. Migration is likely to be one of the major public health challenges of our time, and we believe that further research into this field is needed to better inform public health policies and interventions. Thank you for listening, and I hope you have enjoyed our presentation.